I did my residency in New York City in a hospital called Goldwater Memorial Hospital, where at that time they had 250 people who had been switched from iron lungs to non-invasive positive pressure ventilation. That is getting air like through a mouthpiece or a nose piece or something like that. So instead of getting air through the neck, through an invasive airway tube, in 1953, people in Los Angeles and at Goldwater in New York, instead of agreeing to getting trach tubes, they simply put a mouthpiece on the vent tubing and grabbed it and got breaths like that all day. So they came out of iron lungs and they simply would grab the mouthpiece several times a minute to ventilate their lungs, because some of them had zero vital capacity. They had no ability to breathe whatsoever. So you and I can take 12 breaths a minute of 500 milliliters, or we can take 4 breaths a minute of 1,500 milliliters, and that would give us 6 liters a minute ventilation and enough air to breathe. So the patients in Los Angeles and in New York learned that they did not need tracheostomy tubes, that they could simply ventilate. And then what they did was they started to refuse to go back into the iron lungs. So they slept at night with a mouthpiece under their tongues, and they would grab it several times a minute to get deep breaths. And they actually survived this way. And then in a few years, portable ventilators came on the market. And in 1976, 30 of my patients who were on non-invasive ventilatory support through a mouthpiece, they picketed the New York City Board of Estimate, the politicians, and they said, look, we want to leave the hospital and go in the community. And they got what they wanted. And then I wrote an article saying that it reduced the cost to the government by 77%, because Goldwater Hospital was getting $718 per day, and it was 77% cheaper. And it worked so well that in New York State, they expanded the program through most of the state. I've written like 11 books or medical books. The only people that read my work are not from the United States, and not from England either, but they're from South America and Asia. That's because they don't have, or they didn't have much money, and they actually want to keep people healthy. And they want to avoid invasive tubes and keep people healthy. So I just finished an update of my 2004 book, which was on neuromuscular disease. And this is a respiratory management book, which is finished, and it's going to the printer in the next month or two.